This is Carla with Shade Tree Pets, and this is a week-old blue merle male puppy. We have a little trouble from time to time birthing puppies around here, so we thought we'd take this minute and share a little bit about what we do when we have puppies and how you can avert some problems. Okay, first I want to tell you that I am not a veterinarian, but I have been a breeder for a while, and we from time to time have a little bit of trouble here and there, and we've never lost a puppy. And I've been at this a while, so that's a pretty good accomplishment. When our females whelp, we keep a few things on hand just to make sure that if we have a problem we can fix it. Tools for having babies. These are curved forceps. They're just hemostat, some people call them. They have a locking clamp on them here. When you pull them together, they lock down, and then they can't open them until you push them together and lift up. And they have grooves in them here cut like teeth. And those are kind of one of the important essential things we keep around here. I always have a pair of those when we're having puppies. I keep a pair of small scissors. Now I don't want these scissors to be real sharp, and I'll show you why here in a minute. You need regular plain old dental floss. Good thing to have in your toolkit. I keep hospital anesthetic, just plain old betadine solution. You can buy it at any general store. We keep rubbing alcohol. The rubbing alcohol we pour into a glass, and then all the tools that you might use on the puppy are in there, and they're waiting and ready. We'll set that aside for a minute. Any old bowl, pan, dish that's clean will work. You want it about half full of water. Then you take your betadine solution, squirt that into your water. So when you handle one puppy or another, you can just rinse your hands and dry them. A little money-saving tip on raising puppies, having puppies: towels. I buy towels at every thrift store and yard sale I come across. I bring them home and I wash them in a little bit of bleach. I don't care if the color stays in them or not. I just want them sanitized. And then I keep them in a tote. And so whenever we have puppies, I've got plenty of towels and I'm all ready to go. Now you saw Zoe a little bit ago. Zoe hardly ever has any problems whelping, and her puppies turn out fine. And if the mom is handling it fine, then the best thing you can do is leave them alone, because for dogs have been having puppies for hundreds of years without any help. However, I don't let my mothers eat the placenta, and the reason for that is they generally just go throw it up somewhere in the house, and then I have to clean it up anyway. In the wild, they don't eat it for nutrition necessarily. They eat that afterbirth and the placenta, and will often go off in the woods and throw it up later. Sometimes not, but mostly that's to keep the predators from coming after the babies, because that placenta will start to reek before long if it's just left. Jazz, on the other hand, has a tendency to get a little overzealous cleaning, and she will chew the placenta or the umbilical cord off right at the puppy, and when she does that, then they tend to bleed. If you ever have a female that has puppies that just ignores them, you need to know how to do this. You can save a whole litter. Sometimes you'll lose a whole litter to a mother that is either a first timer or doesn't know what to do. So this is one of the ways that you can help save your babies. Obviously, the first thing you want to do is make sure that you've cleared the sac off the puppy's nose. Now they've spent all that time in water, and I know it doesn't seem like it makes a lot of sense, but they have a little mucus plug in their throat that keeps that water from getting in their lungs, and when they draw that first breath, it breaks that. So a lot of times I stimulate my puppies with the edge of a towel, just rub them to get them to squeal, and if that doesn't work, I just barely pinch their skin and kind of give them a little wiggle. What I'm trying to do is make sure they're filling their lungs with air onto the umbilical cord. The reason for the two clamps, we're going to pretend we got a puppy right here, We're going to pretend this is the placenta's over here, and this is your umbilical cord. I'm going to go 1 to a ½ inch away from the puppy's body, and I'm going to put a clamp on that cord. This puppy is going to be moving around, so be prepared. This sometimes takes 2 people. The second clamp, I'm going to go about 1 inch away from the first clamp. Give myself another, and I'm squeezing down. I want to crush the cord. Now, if this works right, when you got a puppy over here wiggling around, this clamp will give you a little tension is all. And you're going to take a length of dental floss, however long you think you need it to tie a knot. You're going to go between the first clamp and the puppy and tie a square knot. That's just an overhand type knot. I'm going to go first one direction, first left to right, right to left, whichever's easy for you. Do it back the opposite way, and I'm tying 3 times, and I'm really pulling. Okay, I'm going to take that sort of dull pair of scissors, and I'm going to cut this off, because eventually when that cord drops off, Mom's going to eat it, so let's not get too much dental floss in her system. Now the puppy's creating tension on this side, and this will kind of create a little tension over here. So we're going to take this scissor, and we're not going to cut through that umbilical cord. If you were to just cut through the umbilical cord, that clean cut bleeds easier. So what I'm going to do is take my scissors and drag them along the cord, and I'm going to shred it, just like Zoe shreds the cord on her litters. If you hit a tough spot you can't shred through and it's getting kind of thin, you can take a snip at it, but don't cut the whole cord, because then it will really, really bleed. So now once I have this cord separated, oh, see, scissors are dull enough, they may not cut that. Oh, there we go. So now once I have that separated, I have my placenta laying over here, and I have this puppy. I'm going to take the clamp, pick the puppy up, and I'm going to give him back to his mom. I'm going to leave that clamp on there for as long as she won't bother it, 10 minutes or so. And that helps for that to coagulate. Now, if you're squeamish and you don't like to touch this placenta, that's fine. You can pick it up and put it in the garbage can that way. I just take the clamp, pick up the placenta, take it to the trash can, get it there, and drop it. Now, the reason you don't take the clamp off until you get to the trash can is because when you do, the end of this cord will leak fluid, and we don't want drips all over the floor. It's no big deal if it does, but it just saves you cleaning up another mess. I hope that helps you. That's the way we get our puppies delivered here at Shade Tree. We hope that helps you. If you have any questions, you can always go look for more information at shadetreepets.com. Thank you.